SINGSONG Medical Services, situated at number 22B, Patterson Street. Because SINGSONG is a healthcare service which renders both stationary and mobile health services to the public, and it has been operating for over 3 years, and it has been a viable business. Though challenges are there.
Like all businesses.
But for the past years, we are able to secure a property which is situated at Patterson Street, and we have a record of over 1,000 clients that have benefited from that services. I am a pharmacist, microbiologist, and physiotherapist by profession. I've operated in both public and private entities. Been working at Connaught Hospital and Lonely Hospital, Emirates Pharmacy, People's Pharmacy, and in all those years of experience, I've seen the need for this kind of services, because the healthcare sector in this country is really below standard, and the quality of drugs that are available are mostly below standard. Based on my experience in the pharmacy sector, I have developed an idea wherein I have built an entity wherein people can have affordable and most genuine quality drugs that my services will render to the public, and at the same time have a personal relationship with patients, which is somewhat lacking in all competitive clinics. And at the same time, I've been seeing people that are discharged untreated with diseases like hepatitis B, dementia, typhoid fever, still going on untreated. And basically reporting and having this entity have really created a remedy issue for them. Of course, it is a case study where we have records of those people in the office. And of course, we have a laboratory that normally does quality testing. Of course, I supervise, though I have a lab team, scientists also engaged with that. And of course, we have a medical doctor by the name of Dr. KB, who is our senior medical personnel. And we have nurses that are also engaged. And we are also helping the community, of course. It is a densely populated community. Of course, it's situated at the Brookfields area, have a lot of cases, of course. And though we are competing with other clinics, but our services is quite different, because we do mobile, and at the same time we make sure that we provide the quality drugs that we have, compared to other clinics where the doctor just prescribe and people outsource their products. They will not have time to supervise what kind of product they bought. This can cause other challenges in their system, wherein you consume drugs that are not really proper because they have not been supervised. Personnel that are running it.
SINGSONG Medical Services. Are you a hospital?
It is a healthcare service. It's a health center.
What's the name of SINGSONG?
SINGSONG is like a dream. I dreamt of this vision That's why people see it as a Chinese business. But it's a dream. I dreamt the name. The name was dreamt. I don't even start the business at that time. It was really a challenge. Going into the business, I started it with 200,000 euros.
Really? The meaning of sing-song.
Sing-song, well, it's like giving thanks to God after everything. Sing songs of praise, actually.
Sing songs of praise.
SINGSONG. So I entered. It's like a patent, sing-song patent before. But since I know where
how does that one match?
Yes, I know where my vision is heading.
What I'm talking about, the name
The current service.
and the service.
Yes, the actual dream was SINGSONG Medical Services. It was a big,
still getting
big building.
Hold on.
Yeah.
Kamara. I want to get it clear. You're engaging in medical service, not so? And then the name, how to rhyme.
No, now the name is SINGSONG. It's a registered business, SINGSONG Medical Services. I'm just trying to tell you where I started and where I got, where I'm now. No?
You still haven't got clear, okay. You
Yes.
still haven't got it clear, but
The SINGSONG and the medical services, you mean?
yes, you're engaging in that kind of service.
Yes.
And then you give it the name Sing-Song.
Medical services.
That's
Well,
that's
the-
a full
okay,
name.
alright.
SINGSONG Medical Services is the
Okay.
full name
Okay.
of the entire entity.
Okay.
So please, who are your team members?
Of course, I have a medical doctor now, of course, and we have about 6 nurses, early and night. We have runners, we have physios, we have 2 physios, we have pharmacy assistants. Of course, I am the proprietor,
Yeah, who?
Joseph Ekikam.
Yeah, what's your position?
I'm the proprietor.
Yeah,
The
yeah,
CEO.
Yeah, pharmacy
yeah,
assistant.
pharmacy. Okay, you say you deliver home health care. What do you mean by that?
Home healthcare services. People are sick sometimes. You see the kind of environment, the ecology of the entire country. People don't know how to build houses and they are staying away from medical entities. And at the same time, they need help, wherein they have conditions which cannot even tolerate them to wake up and come to the hospital. We render that kind of services wherein we go and rescue and remedy them, even at the peak of their need. We have bikes that we use to reach those places and see that we remedy them, out of good things. And some people are shy in coming always to the hospital, do not have time, with their leg ulcers, publicly. Some people are shy enough to go because after 2-3 months, they still do not recover. So they prefer an health service that will go and treat them at their convenience, wherein we take care personally. We have a way to talk to them. People that are suffering from dementia cannot be remedied in a public entity. They need personal counseling. And for aged people, some of the research that we conducted, Sierra Leoneans don't know how to handle people that are aged. Some are at home, really they don't know how to handle their situations. So we cater for those kind of people, wherein we send in nurses that will go and take care of them. Some people, they are suffering from leg sores and some other issues there, wherein they are just left.
I'm sorry, I'm not understanding the concept here.
Yeah.
You provide medical services.
That's
Are you
why.
an NGO?
No, I'm not an
Are
NGO
these
because
guys
it
paying
is
you back?
resourcing. Yes, I have. We have charges for that. It's just unfortunate I should have come with my brochure. We have charges for that for healthcare service where it ranges
Send
from.
some charges. Things like say 300,000 for this,
Yeah.
so send some charges. So
We
now,
have charges for.
how do you identify these guys that need home health care? You go to their house one by
No,
one,
no, no.
find out.
It is on the media. We despite our challenges, we are able to engage only BBN because it's only the one that we can afford to advertise our product. You understand? It is on BBN. radio BBM, the radio broadcasting service, because it's somehow cheaper. We should have engaged other types of form of advertising, because it's a quite new product that is really challenging and it's really profitable, it's valuable. People need it. But it's like if we are blasting again and we don't have the resources to try to reach out to those people, then we will not be effective.
Okay.
So we try to engage one radio station that can at least be able to cope with the amount of strength that we have for now.
I've got quite a lot of questions for you actually, mostly involving costs and things. I find this to be what you're asking, or your new business plan is very highly capital intensive. I'm just wondering, from your existing business now, what's your turnover margin? I mean, you put what you come in with, which is all your assets again.
Yes, my assets.
Okay, of 319,000.
So my assets, that's just my assets. Those are my assets. I have a fixed asset which is worth over 600 million because the building belongs to us.
The building is yours. Okay. So that's okay. So that's what you mean as
as my startup.
How soon do you expect this to make something out of this 500? Say you get 525 million from your sponsors or wherever. How soon do you think you break even from turnover?
My break even has been really encouraging since I started, of course.
Yeah.
I've acquired short things.
Well, I'm not talking about what you do, I'm talking about this money free.
Yeah, this
if
money,
you get all these sponsors, not just here, anywhere else that you do.
This money have a potential of having a turnover of over billions of euros within the next 2 years.
You worked it out with the demand and the people. You've actually got the data
exactly,
set up.
yes. Everything is set up and it's a recorded issues that we normally have.
You didn't give anything like that to us to assess?
The financials, I know one day we will have that kind of assessment, of course. We have all the records available.
I'm a bit, I don't know, like I looked at the emergency health issues. How many do you have currently and how do you assess the cost? I mean, for me, everything has to be figures in my head.
Well, normally, our cost is really affordable based on...
Well, I'm talking about a particular thing, like emergency health issues.
Emergency
How many do you have currently that come to emergency health issues?
Every day, I mean, it's
how many
for the month. Like
for the month.
For the month, we have 10 to 20 recorded for the month. Because we have succeeded, if we treated this, we expect that
so
we will
that's
succeed.
Averagely one.
Average, yes. So one will be out and some will retain us for the next 2-3 months. Others will be successfully treated, so we delete them, or at least we have a full number.
What's sort of the split of those that are coming to you versus
we have those that are coming up. We have a series of people, of course, it's a community health clinic also. People that are sick are still coming in. So those other patients have their own data also.
So I'm so sure is most of your business now
Yes.
in the center?
In the center.
Or outside the center?
Can I get you?
Most of your
Clients.
business
Yes.
today is happening in the center or is happening in your patients' homes?
That's why we said we have an entity wherein it's public.
Yeah.
When you say it's an health center, of course, government knows this one is registered. It is based, it's also serviceable for every community. Understand? So we also cater for those at home. So as long as we open to general public, we also cater for our personal cases at home. So that's why we say we are mobile and still.
So where do you refer if you don't have the facilities right now, you don't have scanner, you don't have some equipment and you don't have. So when they come to you thinking, where do you refer them to?
Of course, we have Dr. Kozia, radiology.
So those that will be your competitors.
Yes. They normally handle those issues. We do refer for now.
So how many you get that you refer? How many referrals do you get per month?
For so far, like for the month, we have 3-4 that will be coming. Some with stomach pain and those other things.
You cannot offer those services.
Yes, we cannot offer those services, and we have the potential to do it, but we
basically all your clients are clients from your medical service.
Yeah.
From your health center.
Yeah.
Not to outsiders, not people outside.
That's why I said we also do outside because we are
for those
outsiders,
how do they identify your services? How do they know what you have to offer?
Yes, because it's as a signboard based that we have a laboratory and everything. And
now I'm talking about the home health care here.
Or the home health care, I said it is already on the media that we have already, we have engaged with BBN that is doing a minimum advertisement for us because we are not able to do well in marketing for now. You see.
And what's the current clients base?
Yes, I said we have
regarding the home health care.
Our client base for this home care, those that we have already recorded is over 1,000. We have recorded about 1,600.
For your staff, what health and safety measures did you put for your staff? Because most of the time you see most of these health centers.
We are so conscious, and to be surprising, despite all these issues, we have challenges in the Ebola, and we have been working with people, and none of our staffs are really, affected with Ebola.
So are you telling me during this Ebola period
we have been operating. We never close. People were looking at us as being the rescue, the safe haven, where other doctors were running away. People have hypertension and they have other diseases at home. We were in the mood. We were able to remedy them. Some people, we are so blessed because they will have been taken to the Ebola center.
Within free time, you can go anywhere?
Yes, if we have the capability, we are planning to engage the services in all districts. We have the capability because it is potentially valuable in every community because people lack medical facilities like this. And to have a genuine drug, you need somebody that knows everything about the drug that he sells.
So what are you going with your competitors, the other pharmacies that are around? How you say they're genuine drugs, so what's your cost margin? Because if the majority that comes here you say is not genuine, then how are you going to beat that with yours that you say is genuine?
Well, I normally engage in differentiation. I don't compete like we are having. I want to sell the same drug because I normally look if your drug is of lower standard. I will try to differentiate mine.
But I think I'm very profit margin as well. If you're going to bring something,
yes, the profit margin also is also in the pipeline. Yes, but yes, still I know the kind of people have confidence because I've been in the medical profession. And they know whatever.
Well, I don't know about you, so you're advising me. I don't know about you.
Yes, but
so how would I give you the only one?
I know one day you won't know. And if the drug I'm selling, if you are selling paracetamol, I don't need to find the same paracetamol that you find it. I want to look at something that is quite different, that have the same, maybe of the same cost of MAP or lower cost based on the components that you have.
So where do you get your drugs from?
I have suppliers for now. They are limited from Belani and Sons, and People's Pharmacy, of course.
So they don't bring for the same people.
Yes, they bring for the same people, but there are certain drugs.
It's the same drug.
No, there are certain drugs that they are normally not sold because of the rate of prices, and there are some certain issues. And we have a German company, very cool, that normally comes with other drugs. I normally find drugs based on my clients, and some people normally go in for drugs that have certain brand and quality. So I try to cater for all classes of people. Those that are around my community, I try to know their taste and passion and their brand and the need. Try to beat my competitors with that kind of idea.
You've listed here medical machines. What medical machines are you talking about?
Physiotherapy. We have a chair like this that is a vibrator. We have both hand and
the chair is the vibrator?
Yes.
Is that what we have here as the vibrator machine?
Yes, different types of vibrators. We have vibrators. We have vibrators. Both hand, feet, the back. These are all vibrators that we normally use to aid physio. And of course we have scanners, which we also need, of course.
What you have here in medical machine? What do you have listed?
For the one I have now is the simple vibrator. Which one?
You already have a vibrator here.
Yes, but we need another vibrator. That's what we're asking. In our needs, we also need vibrators. We are using vibrator also.
That's what I'm saying. You already have vibrator listed here.
Yes.
That you want to buy. You need to buy 4 vibrator machines.
Yes.
But still on the same list, you have one called medical machine. What is that medical machine?
It's biochemistry analyzer and hematology.
You have a biochemistry analyzer here already.
Yes, hematology analyzer.
Hematology analyzer.
Yes, hematology.
What do you mean hematology analyzer?
The blood. To analyze the blood, the moment you place the specimen in the slider, he will detect and know exactly what is wrong with your blood. Give you analysis of your.
Is it done? Are we done? Okay, thank you very much.